This radio show is brought to you by All In Cincinnati. All In Cincinnati, an equity coalition, is sponsored by BI3, Greater Cincinnati Foundation, the Carol Ann and Ralph V. Hale Jr. Foundation, Fifth Third Foundation, Interact for Health, and the United Way of Greater Cincinnati. Thanks for tuning in.
We're rolling together now. We're rolling together now.
Hello, and welcome to the All In Cincinnati radio show, where we are all in it together to eliminate disparities and inequities for Black women in Hamilton County. I am Denisha Porter, and I'm honored to serve as the Executive Director of All In Cincinnati and host for today's segment, Addressing Disparities in Maternal Health Care for Black Women. To begin, we must understand the definition of maternal health. The World Health Organization refers to it as women's health during pregnancy, childbirth, and the postnatal period. The most common direct causes of maternal injury and death are excessive blood loss, infection, high blood pressure, difficult labor, and indirect causes such as anemia and heart disease. Most maternal deaths are preventable with timely management by a skilled health professional working in a supportive environment. Unfortunately, the Kaiser Foundation reports the following racial disparities in maternal health care. Black women have higher pregnancy-related mortality rates than white women, and racial disparities widened during the COVID-19 pandemic. Black women have pregnancy-related mortality rates that are about 3 times higher than that of white women. Black women have higher shares of preterm births and low birth weight births or births for which they received late or no prenatal care compared to white women. Approximately 700 women die each year during and following pregnancy and childbirth. This number is unacceptably high. Today, 3 esteemed guests are working tirelessly to address the disparities in maternal health outcomes for Black women in Hamilton County. So I traditionally do introductions, but I want to turn it over to you guys to introduce yourselves. So let's kick it off with Marche first.
How's everyone doing? Thank you for having us, Denisha. We really appreciate it. My name is Marche Gendrew. I am the expansion manager at Queens Village. And Queens Village is an initiative under Cradle Cincinnati, which is a collective impact organization that fights high rates of infant mortality that disproportionately affect Black women in Cincinnati. And Queens Village centers Black women's voices, shifting not only racial disparities, but better outcomes for Black women and families.
Beautiful. And then we'll turn it over to Shanetta.
Hi, my name is Shanetta Cottrell. I am the HPE Grant Coordinator for Hamilton County Public Health, but in this realm, I am the Project Coordinator for Ohio Equity Initiative, where we are trying to minimize the disparities in Black births and infant mortality. I'm very happy to be here. And thank you so much for inviting me.
No problem. And I see you're sporting the shirt. You're repping.
I'm repping. Things to do today.
All right. And then Jamaica.
Hello. Again, thank you so much for inviting me. My name is Jamaica, like the country. Mm-hmm. That's what all my friends call me, so you can call me that. I am also here in the capacity of being a part of OEI. I'm one of the neighborhood navigators, and I'm also a doula and the executive director of Black Birth Circle, which is a Black doula collective here in Cincinnati.
Love it. All right. Well, welcome, Queens, and thank you for joining the All In Cincinnati radio show for today's discussion about maternal health in the Black community. And let's just kick it off. Let's just start. So, ladies, we've heard that the national statistics about maternal health disparities and the many stories of famous Black women whose maternal health issues have been publicized. Although many of our listeners have experienced challenges in and around the birthing process, I would love for you to tell us what you see on the front lines in your work every day. Who wants to start?
I can start.
Okay.
So, where to start?
I know, so much, right?
It's so much. I love my work because I do get to sit knee to knee with these Black mamas and really hearing their experiences with OEI and as a doula. So things that I am hearing is that they just want to be heard and listened to. I've done multiple intakes, and when I ask moms, like, what do they want out of their birthing experiences? Most of them say, I just want to be alive.
Yeah.
And
Right.
I just
to
think
be
that,
around for my child.
yeah, I think that is just such a concept and just such a baseline that that is the experience that they are looking for, is just life for their babies and for themselves. So that just really tells you what the attitude is in the birthing community, is they truly feel like they are going to die.
Or their baby might die.
Or their baby's going to die. And there's a lot of scare tactics that go on from clinicians. That's truly one of the first things. I just had a client that was going for her VBAC, her vaginal birth after cesarean, and was told that if she tried to TOLAC, so if she tried to have a trial of labor after cesarean, that she would have a stillborn.
Oh, wow.
And there was nothing wrong with her or her baby. Baby was tracing fine. Baby was monitoring fine. She was monitoring fine, not high risk, other than just being a bigger bodied Black woman that wants to have a baby naturally instead of having major abdominal surgery. Right. Like it's such, again, a concept that people are just like, you should just have a C-section because it's so easy. Yeah. And it's not. It's not that easy. Right? It's a whole procedure. Mm-hmm. So, but mom and baby are doing very well.
Love the great update.
Exactly. Great update. Mom and baby are doing well. No stillborn. But, she really had to trust in her body and her baby to tell her what was the best thing for her. And in the end, she got what she wanted.
I love that. Definitely trusting yourself. Yes. Definitely. All right. With the head bob, Marche.
I always call with that church.
Every time.
That's that church head, that church nod. Mm-hmm.
Preach.
To follow up what Jamaica said, I think the consensus in general, just with Black women across the board or just Black folks across the board, is that we do want to be heard. Mm-hmm. We oftentimes are encountered with doctors, nurses, or folks in the medical field that have bias, right? Whether it's unconscious or conscious, and we all have it at the end of the day. So we can expect specifically white folks to also have that bias, and we all know that when those biases and white folks show up, that our care is a little bit different, right? Mm-hmm. When, especially Black women in Cincinnati that are 3 times more likely to have a preterm birth, like, that's an alarm, that says, like, we have a big issue here. And not only that, like, it deters our Black women from going to seek help, to go into the doctor, so it's a problem across the board. And I think, like Jamaica said, just again, echoing the fact that we want to be heard. Like, we are not ignorant to our own bodies. Like, no one can tell us how to feel about our own bodies. And when we're expressing these things, like, we want to be heard and be taken seriously because our lives depend on it.
Right. Anything you want to add?
Well, part of the question, I believe that part of the question was also about us, like, well, no, because the thing is, we often focus on the fact that, there's the Black women out here that are getting pregnant, but we also don't address the women who are out here trying to get pregnant, especially the Black women.
That was my follow-up question.
Oh, my bad.
That means that's what it was supposed to be. So go ahead.
My bad.
But the thing is that it's oftentimes where Black women it's harder for Black women to get pregnant. And then once you get pregnant, if you're able to get pregnant, then it's like you're not treated correctly once you get there. Mm-hmm. And so it's just a cycle of, like, I just want to have a healthy pregnancy. I want to be pregnant. And not all of us are out here just like, oopsie. Yeah, not everybody's an oopsie. Some people are out here trying to get pregnant and can't and need the assistance. And being able to find doctors who look like you or even clinicians that look like you is always a struggle. So being able to work in the system where even though they don't look like you, being able to have people who treat you with respect, even though they don't look like you, is an issue and it needs to be addressed.
I love it. So I want to go back to Jamaica really quickly. You said you are a doula. Can you tell people what doulas are and what you do and talk about your birthing circle?
Of course. So a doula is a non-medical support person that gives birthing people support during their pregnancy, during their labor and delivery, and postpartum. And that support can look a lot of different ways. It can be educational support, emotional support, physical support, and of course, advocacy.
Mm-hmm.
So
talk about that advocacy.
Yeah. and so, yeah, actually, let's talk about advocacy, because I think that we throw that word around quite often. And we want to try to also hear the word empower women to be able to advocate for themselves. And in the doula community, especially, there are multiple trainings, mostly white trainings, that tell us doulas when you're being trained that you are not to advocate for your client, that is not something that you do. Truly.
I've never heard of that.
Yes.
I wanted you to talk about it.
No, yeah, we're talking about it, that you are not to advocate for your client, that you are to empower, quote unquote, your client to advocate for themselves. And I think that is a privilege and a luxury that comes with being white, and that because we are already so minimized and silenced, that having a doula present is to have another presence and another voice in the room. So why would I go into it as a doula not going to say anything? Like, they're already going to try to squelch whatever my client is saying. So I have to be a voice in that space also. So advocacy can look a couple different ways. Of course, we want to empower moms to be able to speak their own truths and be heard. But the doula is also there to kind of be that hammock to kind of carry them through. And, if they don't feel like they can, I don't know if y'all have ever had a baby, but sometimes you can't even remember your name and those contractions. And so let alone trying to take all the histories and everything and trying to speak, and when you're being talked at, and trying to be sure that people understand your wishes and desires when you are already being so silenced, and also having to be in the throes of labor. So as a doula, that is something that we do to try to protect that space, be sure that moms' births are not happening to them, that's happening with them, that they are not some bystander of their births, that they are an active participant, because I'm sure they're feeling like an active participant of this.
There's a lot of activity.
It's a lot of movement. A lot of movement going on.
A lot happening.
Right. But I love that, because sometimes you just need support. You just need somebody to have your back, somebody just to speak up for you when you don't have the words, just to know that they are in it with you. And if you don't have the words, I'm going to support you, sis, all the way through. And I think that, the head bow out. See, I'm going
to go ahead and hop on in there real quick. But, I love that, because I think that when, like doulas or social workers or folks that are walking hand in hand with, women who are pregnant, specifically Black women, that is the action, right? Is to show them that you can speak up for yourself, you know what I mean? And that you don't have to do it. Sometimes it's the model, right? It's that action is the model. Like, that's the empowerment. So, to debunk this particular training specifically for like white women, which doesn't make sense. Like, I can't even even fathom that concept of like, yes, empowerment, but don't you say anything? Like that just sounds
exactly what they say.
That just literally sounds like it's perpetuating again like this white supremacist and like this mentality of like you're not important either. You know what I mean? So, we have to debunk that idea and like literally lead by action. You know what I mean? And be the model for the folks that we're serving.
All right, now you got Shanetta on the head, Bob.
Come on, head, Bob.
Well, no. The thing is, because you think when you're in the space, you think about your own birth story, and if you've had children, then you have your own birth story. And one of the reasons I'm passionate about this is because I think about my birth story and the fact that I had my kid 29 weeks early. She was at 29 weeks. She was 11 weeks early. And I still, now I probably know, but for the longest, I did not know why she was born early. Nobody explained anything to me. Every time I went to the doctor, it was just like, how you doing? And I would say fine. And then, we're going to keep you in the hospital. But there was no conversation. And I think the whole point of having these doulas, being able to be there and being able to even talk to you about like what's going on. This is what happened at my doctor's appointment. Or even just like, I'm able to call you and be like, okay, so they're telling me I'm about to have my baby like right now. Like what? Why? Yeah. Like what's going on? Somebody saying, okay, asking why. I didn't even ask why.
Oh, wow.
It was just like, I want my mama. Literally what happened. Right. I wanted support. Yeah. And so, but I never asked why. Why am I having my baby early right now today? Like right now? All of those things that happen and having someone there that knows, that's knowledgeable. And it wasn't like I was uneducated. Just in case y'all don't know the statistic, it's not because you're uneducated. It doesn't have anything to do with your age, your social, economic status, any of that. It has nothing to do with that. Your educational level, none of it. You still have poor health outcomes just because you're Black. So it wasn't like I was uneducated, had my degree at the time, but still, here we are.
Right.
Yeah.
If it happened to Serena Williams, with millions of dollars in her pocket, it can happen to anybody. And that literally, and she lives in like a, she is pretty, she's very much well off. Like
well known too.
Well known and well off. So if things like that can happen to that Black woman, like, it's pretty scary, like, us down on, you know what I mean?
Regular folk.
Regular, you know what I mean? Like,
they like God folk. We out here regular living and still,
Yeah. But she used her voice. She knew what was wrong with her body. Trusting your body.
Yeah.
Trusting in your body is what I'm always saying to my clients. Like, you're going to trust in your baby, trust in your body. You have to believe that you can do this. Like, if you believe that, then you can do this. Like, speaking of my own birth, I had a VBAC, so my third kiddo is my vaginal birth. And after 33 hours of labor, I thought that, what was I doing, for one? Why was I trying to do this? But also 33 hours of labor. And I started doubting myself. I started thinking, am I just doing this because I want some accolade of having a vaginal birth because that's what's going to make me a woman and a mom and everything. And my doula, she got down like eye to eye level with me. I remember I was crouching forward and just crying and being like, I'm not supposed to be doing this. And she's like, how dare you not work as hard as he is? Referring to my baby Biggie. Shout out to Biggs. And because Biggie was like, he was on the monitors. So his initials are XLG, so we've always called him Biggie. He's exactly. No, so to this day, people never know, and he's 3. No, he will never know why he's called Biggie, because he's a very moderately sized child. And
he had to be big or small.
No, he's a very 50 percentile sort of kid. But yeah, so she said, how dare you not work as hard as he is? He is showing you that he is totally okay, that he's fine, and he is working with you to get down and out. And that is the reminder that I needed from my doula, to trust in my baby, that if anything was wrong, he would have told me. That I needed to trust in my body. If anything was wrong, my body would have told me. So shout out to my doulas. I had 3 doulas in the room, by the way, and I did. I had 3 doulas.
I need one for my mama, my body, my soul.
No, truly. I'm gonna actually tell you the absolute truth. One of my doulas was a white woman. And I remember she actually got food poisoning during my birth, and she was like throwing up, dying, and she would just sit on the couch, and she's like, "I'm so sorry." She kept on apologizing, and I was like, "I would prefer you to just sit on the couch and like lay down, because I know that if something was gonna pop off, that you would wake up and you would keep them from killing me." I said, "Do not let me die in here." And she had this voice, like she was a white woman using her privilege for my benefit. And that is what I felt like I needed. I needed a white folk on my side.
Right. Okay.
And that's what I had. So she laid down, and like I remember my water had broken, and they were trying to come in and drink my water. And she popped up, and she's just like, "I think everything's gonna be okay. I don't think that she needs her water broken right now." And then they were like, "Okay, is that how you feel?" And I'm like, "Yeah." What she said, "Yeah, I don't need my water broken right now." And she laid back down, went back to sleep. I was like, "Thank you so much." So she, even though she was like kind of hands off at that point, but she was on it. She was not gonna let anything happen to me. And so was my other doula. She told me, "How dare you? Like, you want to give up?"
Right.
He's not giving up.
Yeah.
So no, there is no giving up. Trusting your body, trusting your baby. And that's what we did. We got him out the same day that, never mind. Yeah.
I do got a question though, like a follow-up, or even just like having the conversation about like understanding what our body feels like, because I feel like sometimes like we don't know.
We don't.
You know what I mean? Like, and it's like, how do you, as a doula, right? Or, folks in this space, like, how, like, what do you say to our mothers about what's going on inside, and how does that, like, how do we feel it, right? And understand it and then articulate it.
Right. Okay. So hopefully that moms get to doula care during their pregnancies. So that's something that's really important, because you would like to build that rapport, build that relationship with that doula. And during your prenatals with that doula, we're going to be talking about things like that. We're going to be talking about that birth is one of the only times that pain does not mean something bad, So because something is hurting, we need to know what is the pain of labor, as in a contraction, versus a pain of like a stretching pain, a piercing pain, a gradual pain, a contraction, especially a contraction that moves your cervix, is going to be like a mountain. So you're going to feel it come on. It's going to have a peak, and it's going to come down, right? Yeah. Anything, and when you're not in contraction, you should not be feeling pain. So we talk about, you should not be feeling pain.
I think you feel it the whole time, but no.
No, you should not be feeling pain. You can definitely feel some like soreness of labor, of like the stretching of labor and everything, but you should not have any. And we're going to use like, what are the adjectives? We need to describe this pain, because oh my goodness, do you know how many clients that I have had that are like, they're in pain because their epidural didn't work or something like that. And they're like, and there's clinicians that are like, "Oh, that's pressure." And I'm like, I think this girl has pooped enough days in her life to know what pressure feels like versus pain feels like. Like pressure is that feeling you know what pressure is. Like, you know what it is. It's that urge, like you got that. That's pressure versus pain.
Right.
You can't say poop. Oh my God.
No, you can't.
It's poop.
I can go too much farther than that.
I mean, you all have pooped. You all understand what the feeling is. Yeah. But so again, going back to what you were saying, is like knowing the difference is that we talk. I'll say things like that, like during my prenatals of, this is more so the things that this is going to feel like. These sort of things, striky, stabby pains, hot pains, lightning pains, those sort of things aren't necessarily okay. It matters where we are in pregnancy, and because there's lightning crotch, so that might be okay. But like during labor and delivery, these adjectives are what we should be describing pain as versus these sort of adjectives.
Is there a resource out there?
Get a doula.
Yes.
And also, actually, the Educated Birth is a really great website, and it's infographics, and they're super diverse, Black big bodies, queer bodies. Like, I absolutely love the Educated Birth, but I use a lot of their handouts and everything in my prenatals, so I get a lot of stuff from there.
Oh, I love that. Well, so you talked about personal advocacy. Marche, can you talk a little bit more about like policy systems and advocacy work?
Well, yeah. Number one, policy is hugely important in any work that we do, because that's what really moves. That's what moves things, right? Like,
Moves the needle.
it really does. Like, policy is like the catalyst to all the things, right? And it's important that, you know, we are out in the forefront of like understanding what, you know, the bills are like in the state of Ohio, federal laws that truly impact infant mortality health. Cradle Cincinnati works very closely with a group of folks from all over Cincinnati that focuses on policy, infant mortality health in so many different aspects. All In definitely has been a huge partner in that aspect. And so the work that we do, in fact, recently we were at the state of Ohio with hanging out. Yep. And, you know, and it was an amazing event, and it was Groundwork Ohio, my apologies. And it focused on infant and maternal health. Like, it literally talked about like, you know, the work that we're doing on the ground and like the policies and what's being moved. And also is a big time because of budgets, right? Budgets is a big part of, you know, programming.
Right.
And it's important because, you know, as Jamaica was talking about doulas, you know, the state of Ohio is currently working on this big, you know, policy, this bill, the doula bill that's literally will change lives. Like, it is extremely important that we support this bill. And one way to do that is to go to your Ohio legislators' website. So if you want to know like who is my representative, whether it's in the Senate or the state, go to the Ohio legislator, put your address in, and you'll be able to write your senator letters. You're able to write the House letters, your representative. You can make phone calls to them. So if you want to support this bill, please support this bill. And it's extremely important, and you can go to that website.
Awesome. We're going to take a quick break. When we come back, we're going to talk about what's going good with Black women in childbirth. All right. Thanks so much.
Queens Village is a local nonprofit dedicated to providing safe spaces for Black women and amplifying their voices. The growing team is shifting not only racial disparities in birth outcomes, but also the conditions that drive inequity in maternal and infant health. They provide a safe space for Black mothers to support and be supported by their peers, connect, relieve stress, process trauma, and build a better world together for us and our children. Queens Village exists because Black women in the U.S. are up to 3 times more likely to experience infant loss regardless of socioeconomic status. Not only do they support Black moms throughout their pregnancy, but they also promote economic and professional opportunities for Black women to succeed and flourish, and invest in Black women's leadership, social capital, power through community advisory boards. Join the movement to get involved with Queens Village to help them reach their goal of maternal equity for all Black moms and babies. Contact Queens Village at 513-567-0558.
Welcome back to the All in Cincinnati radio show. Today we are discussing the maternal health of Black women nationally and in Cincinnati. Our guests are Marche Gendrew, Expansion Manager at Cradle Cincinnati, Shanetta Cottrell, Grant Coordinator, Health Promotion and Education at the Hamilton County Department of Public Health, and Jamaica Gilliam, a maternal and infant health navigator and doula. So coming back to you, Shanetta, tell us what's good with Black women, and you can talk about policy and system change too.
All right, so it's like it can go hand in hand. Something that's going on with policy and something good going on for Black pregnant people is that right now we're working on a policy change where we are working with the doulas and within birthing hospitals so that we can come up with a standard operating procedure for doulas so that the doulas can be heard and so that they can be a part of the maternity care team for these moms. So it doesn't make a difference if you have a doula and then your doula is still not being heard and your doula is still not being treated respectfully. making sure that the doula is in there and that they understand that everybody around knows that the doula is a part of that maternity care team for that birthing person is a plus. And it's a plus for everybody, for the hospital, for the mom, for the doula, for everybody. So that's something good that's going on for these birthing moms.
I love that. So it's SOPs in healthcare settings, healthcare systems, hospital settings?
It's in the hospital. So it's a doula-friendly hospital SOP.
Ah, okay. And have you piloted it anywhere, or are you just creating it now?
There was one in, I want to say it was in New York. March of Dimes had one. Oh, I know they were working on one. There's 10. I think there was, it's not necessarily SOP, but I know that they have there's certain places that actually have doulas being paid for by Medicare. So I'm sure they have to have some type of, SOP so they know how to treat these people in these spaces. But I do know that the March of Dimes was working on in New York.
Gotcha.
Earlier this year.
Okay. And then Marche, anything about policy and system change?
So I just wanted to add, the work that Queens Village Cradle Cincinnati is doing with regards to system change, which is super cool. We have this thing called Mama Certified, which is happening. It is up and running. Please check out the website. But essentially, it's a program designed to provide Black parents to be a meaningful experience and have a successful relationship, if you will, with our doctors that they encounter. And this is a kind of a big effort across the board when we're talking about hospitals, like the large hospitals in Cincinnati. And the cool part about this partnership and Mama Certified is that, once this work is out and being able to, connect this with the doctors, how it's scaled is that it'll focus on 4 areas: infant care, maternal care, and staff care. And so we'll get that data, and it will be public, and the cool part about it is that we're able to hold our doctors and nurses accountable for their actions and their interactions with us. And so that we're super, super excited about that. In addition to that, we are also excited that, part of Queens Village advisory boards, which we have 5 advisory boards in 5 neighborhoods in Cincinnati. But the cool part is that, where we get our grants from the state of Ohio, the Department of Health, we, as the advisory board, have the opportunity to delegate and say where we want these dollars to be spent.
Budget policy, huge.
Yeah, that is a huge, and that is something that is so innovative. Like, where do you hear where, Black women can say, this is where we want our dollars spent?
Right here.
Right here in Cincinnati, exactly. So, so the fact that, Queens Village, has been the center of that, has been, when I say it's an innovative, system change, and we need to see more of that across the board.
Right. I want to go back and a little bit, because you said something that just had me thinking throughout this radio show, Jamaica, around trying to give life, but at the same time, thinking about your own death. And I know all in Cincinnati, we're doing this health equity policy agenda, and we're basically going to focus on mental health and maternal health, because it kept coming up in our coalition meetings all last year, saying, how do we create policy and systems change that really addresses both of those? And I think what you were talking about really paints a great picture of the intersection of mental health and maternal health. So mentally, you're thinking about, I'm dying or I may die, but then also trying to focus on bringing life into this world. So can you kind of talk a little bit more about that?
Yeah. It's such a juxtaposition, right? Like death and life, all at the same time, being afraid and also being very joyful at the same time. Right. And as a doula, and this is also why I think that all pregnant and birthing people need support, because you need someone there to help you navigate those feelings. I was saying before, I started doubting myself so much during my last birth. And I've had multiple clients that just hit that wall, I don't know why I'm doing this. Like, what am I doing? Like, I can't do this. And I'm just like, what are you talking about? You're actively doing it. So what do you mean you can't do this? And, you know, that things get hard, especially mentally. Like, labor is not just happening to our bodies, but it's happening to our brains, right? Our brains is the one that is giving all of the oxytocin, all of the dopamine, all of the things that we are needing to move labor along, right? So, but also there's still that cortisol. There's still that sense of fight, flight, or freeze, because especially if you are in environments that are giving you that cortisol dump. And especially Black women have the highest resting cortisol rates of all people. So just sitting here, we are statistically more stressed.
Still, right.
It's still in us,
Your heart's
you
still
know?
pumping, yeah.
And so imagine Black birthing people in labor, you know, and what is their stress levels looking like? You know, we ask moms through the OEI, like, what is their stress levels on an average day during our intake? And they will usually say something like relatively low, like a 4 or a 5. And then they will go and we'll ask them what gives them the most stress. And then they will go through this laundry list of things that I'm just like,
that sounds like a lot. Yeah.
We still sticking with a 4? But that's how much that we've internalized it, though.
Right.
Like, that this is just our lives, right?
Because we're taught we have to keep moving.
Just
we have to keep going.
Keep
like,
pushing.
Yeah.
And
Black woman.
exactly. And that
or work twice as hard. Like,
to get half.
it's right.
Exactly.
To not even get the same.
Exactly. So during labor, it's no different, you know, like you still have that mentality that you have to keep pushing. And I tell moms, like, when you say you can't do this, then what we gonna do? We gonna not have a what you want to do? You want to sit here and chill? Like,
Do you sing to them? Do you sing to Jamaica? I know Jamaican.
Sometimes there is definitely times that mamas are like in their head. For one thing that I a little bit appreciate about the pandemic is that it got people, like other people, like the spectators outside of the birthing space, like, and because moms would just be so in their head about other people, right? And I'm like, you know what, you sis? You need a nap. You need a nap, like,
Rest.
and you need a rest, and everybody needs to go and do their thing, while we over here, I'm about to go lay down, yeah, go lay down, go lay down. And this is what I tell my moms. Let's take a nap. I've taken naps with plenty of clients, but one of the things is that
that's a job. Like,
that's what I would like it to be, my job. I would love my job to be napping.
And that's what Queens Village is all about, rest, relax, and
Rest.
restore.
Exactly. Like revolutionary rest. Like revolutionary rest is what is happening and what needs to happen. And that's what it needs to take to get some of these mamas out of their heads. And yes, we are afraid, you know, but we do things scared. All the time. And it's okay. And it's okay. And as long as they are feeling like they are not in it on their own, they're not by themselves, they can do it all.
In this world.
Everybody needs somebody. And this is why I think all birthing people should have a doula. If it's your first baby, if it's your 6th baby, like if it's a set of twins and you've never had multiples before, like shout out to me. Like, I'm just saying, shout out to me. Like every single time, you need someone that is in the room that's just there for you. Like, everybody wants a healthy mom and a healthy baby. Everybody wants that. I hate when people say that, because like that's the baseline. That's the baseline. Like, that's foundational. Right. Everybody wants that. Right. I don't even think that we really need to say that. Like, we don't need to acknowledge that. Everybody wants a healthy mom, healthy baby. But like, what does it mean for this birthing experience? Like, this is one of, like, I had read a study that with dementia patients and women that had birthed babies before, that their birthing stories is one of their last memories to go, that they might not even remember. Yes, so that they might not necessarily remember their kid's name, but they remember how they felt in that moment of having their babies. So I'm just like, this is something that's going to be with you, that is going to hold on to, kind of like what Shanetta was saying, is that I actually feel like you need what we call an unpack black.
Yeah.
Yes. Yes. At Black Birth Circle, we do. Yes. But that's something that we do at Black Birth Circle, is when specifically doulas are experiencing traumatic births, we basically come together as other birth workers. We bring on mental health professionals, and we do an unpack. We let them just kind of just spew what happened and how that made them feel, prompting them to keep on diving deeper and deeper and deeper, so that they don't keep carrying that birth trauma into their next births.
Yeah.
So we
That's
have
mental health again. Mental health and maternal health. They're really
they are so very entwined.
Yes.
And especially and for the birth, we do this specifically for the birth workers, because like they're just being treated as such a resource. Like I love that everyone loves a doula right now. Don't get me wrong. But you can't just slap a doula on the problem and think that, oh, well, we did our maternal and infant vitality initiative. We funded a doula, and don't realize that she and or he or they are people, right? That are going to have this secondary trauma when it's happening, right? So we are not here to redo the system as doulas. We cannot fix the system on our own. We are here to help these women navigate this system. But we still get that secondary trauma. So having collectives, like having us, like Black Birth Circle, in your corner to know that, you know, you are not alone in this, you know, and this secondary birth trauma is valid. Like it's real and it's happening. And if you are going to have longevity in this work, then you need a space to be able to just like let it go, you know?
Yeah. I was just going to add too to what Jamaica's talking about in terms of like mental health, like that, like I think everyone knows like mental health in general is like a big thing, especially, post-COVID. Yes. But now you add all of the other things and other factors in pregnancy and that whole experience in healthcare, traumatic experiences. It's important that you do seek out help. Even, I know that could be scary for a lot of people, and really, and it's very necessary. And I know it's taboo, specifically in the Black community, but it's important, and it is okay to not be okay. Number one. Number two, it is okay to ask for help. Like, as much as we have to keep going and doing all the things, like, we also can use some support as well. Queens Village does an amazing job with, cultivating our wellness program. It is a free mental health wellness program where you can seek mental health services therapy through Serenity Therapeutic Services. Shout out to Serenity, because they're a phenomenal Black led organization that, again, focus on maternal health, mental health as well. So, please make sure y'all seek that out. You can go to our website, Black Women for the Win, if you want more information about our wellness program.
All right. Then, Shanetta, do you have anything to add to that before I ask you your specific question?
Oh, I got a specific question. No, I mean, just me, period. I'm just saying, in order for you to live your best healthy life, you have to address all of it: spiritual, physical, and mental. So just make sure that, like she said, make sure you get help. And it's okay to have to say, you know what, I don't have this all by myself. It's okay for you just to not be okay.
Right.
I agree.
Yeah. All right, Shanetta, what role does health insurance play in caring for and treating Black mothers and families?
So I have had the privilege of talking to multiple healthcare systems right now, especially with the Medicaid. And what I'm learning is that there's so many services offered that nobody knows about. that's just
Well, tell us about
included.
them.
Well, no, it's like included in there. I mean, you get money back just for going to your doctor's appointments. You get money for taking your children to their wellness appointments. You get you can get a free phone. You can get diapers, and you can get pads and all these things just by connecting to your insurance. On that back of the car where they have customer service or customer assistance, call the number. Get the assistance. Like, what y'all got to offer? Because one of the things that was told to us is that how would they know about these services? Oh, if they talk to one of you. That ain't right. So let me tell you what you can do so you can talk to somebody. Go call the number on the back. Call the number on the back and tell them, what you want. Like, what do y'all have to offer for me? And they will tell you. They have to tell you because you ask. But just ask.
Oh, wow.
It's beyond me. That this information is being kept quiet. Why? Why would you keep the information quiet? If this is something that's going to help somebody live a better life, why would this not just be readily accessible?
Available.
Right. And the thing is that we send it out in a pamphlet. Okay.
But we can work on that together. People in this room can make this readily accessible. Let's do a campaign.
Yes, we can.
Okay. I ain't mad at it at all.
And that's really just a part of the advocacy part, right? Like, you know what I mean? It's just like, in education, all wrapped in one. It's just like, how do we have to go and meet people where they are. Like, some folks don't have time to sit on the phone, and be on the phone for hours. Like, I mean, I literally have sat on the phone when I worked direct practices in like different populations, sat on the phone for hours for folks. Like, it is time consuming and it impacts folks' mental health at the end of the day.
And there you go.
Like,
exactly.
And they get frustrated and mad, which is understandable.
They need something. It's like, how can I just need this? Just tell me what to do.
Exactly. Yeah. Or they get misinformation and then they have to get jumped around to all these different people. So yes, like, how do folks like us who are in this room and folks who are in this space, like, how can we collectively put a 1-pager, 2-page, something that is just easy for our folks to read, 4th grade level, make it simple, and just get straight to the point and just provide these resources, because half the battle is accessibility. Like, we don't have access to a lot of stuff, and not having access is also being ignorant to what's out there.
Right.
And it can be overwhelming. You know what I mean? Like, it's overwhelming for us, I think, sometimes, as much as as much information is out there. But if we can get what's important, put that on a website,
do a
social collective
media
impact.
Campaign. Yeah, there you go. We gonna do it.
We put the ideas.
And also, like, let's hold these resource agencies accountable. That's one thing that we do with OEI, is that we really want the feedback from these agencies. Like, on paper, everything works, right? When it comes to housing, when it comes to that's all I'm going to say. So there's all these resources, right? On paper, is that the county is saturated in resources. And so when the higher ups look at on a piece of paper what we have, they're like, why do we have this problem? Because it's not working in a way that's being helpful in your community. And so it's working on paper, as in, like, mom calls X, Y, and Z. They get back to them by this date, and then they're supposed to get them a voucher, but they don't tell you that nobody calls you back. Right? There's a waiting list that is as long as the Santa Claus naughty list. Once you get the voucher, you get 30 days to use it. Nobody's going to help you try to use it. Yeah. Nobody's going to help you, like, navigate the system of trying to figure out where you're going to live, how you're going to move. No one's helping you move. And especially, have you ever been a pregnant woman with 4 kids under the age of 5 trying to move your entire house in less than 30 days?
Oh,
it is.
Oh, wait.
So, like, we have a housing. We have a housing resource, but that's what it looks like.
But,
so I just want to say, Jamaica was like solo, like me in the chair. And
I'm not set up for that.
She just set up. She real tall in here now.
Then I tell you I was gonna turn it on and y'all didn't believe me? Ain't nobody believe me.
I think you got like Marche. Marche is what, an escalator? Is
Yes,
that
I
what it
am. Hey, go to
I'm a
the top.
disruptor.
And you're disruptor.
Yes. Escalator disruptor. I like that.
Shanetta, what are you?
I'm just a listener.
You're
We need all three.
you're an activator.
I can thank you. I appreciate it.
We need all three. Yeah, we need all three. But I in all realness, like Jamaica, those like you are absolutely right. Like it is insane the amount of hoops and loops that families have to go through. Like, and this is like through all of these institutionalized systems. You know
All
what I
of
mean?
them.
Like
That's the
when I say
thing.
all of them, and that's the work that I do outside of Queens Village. Like I've worked in all of these systems. Like I've helped families in whether they're elderly, LGBTQA+, whether it's, children and families, working at JFS. Like, I understand what it takes. Like, it is a lot. Like, I think even as humans, us that are here today,
right.
struggle to even... with some, you know what I mean? Like sometimes it's just hard to get to the day. You know what I mean? And so we should not have this expectation of our families to be able to just get it because they don't.
Right.
You know what I mean? So it's a lot of holding hands,
patience,
time, yeah, and grace. Like and I love what Jamaica said about making sure that or these organizations are being held accountable, because that is equally important, because it's all and I've worked in spaces where it's about checking the box,
right? And life
and
is
it's
not
like,
about a box.
it's not about a buck to meet your quota, so you can continue getting your funding to like fund these like programs that are not
I
sustainable.
can show you on a piece of paper that I did my
It
job.
worked, yeah,
That it
like,
worked.
it's-
Okay,
but
the box are checked.
Yeah, but it's also like yeah, talk about it.
Y'all,
It's irritating.
It's because y'all have not. Because I've had to be like trying to help a mom literally that is pregnant with 4 kids under the age of 5, living in her, she called it a van. It was a Traverse. It's not a van.
Wow.
Like living with her 4 children, and she has a voucher. She has a housing choice voucher. And she literally is living in her car under a bridge. And so I'm just like, so yeah, I'm a little hot.
That's
When
the
it comes to that, like, I don't understand why this is this is not working the way that it should be.
I mean, it is. You're absolutely right. And in Cincinnati, affordable housing it's a real crisis. Shout out to like safe housing as well, and shout out to Mona Jenkins over there, like the homeless coalition, who is in it to win it, as well as
I just spent
Janelle.
some time with her. She's amazing.
Phenomenal. Like she's been working on this for years, and it's just like she already done told y'all years ago what was going to happen now. Like, and now that it's here, it's like, what are we going to do? You know what I mean? And it's just so unfair. And I hate to hear stories like that. I've also, have walked, with clients like that who are just like, I mean, literally 10 kids, ain't got nowhere to go. Like, where do you house these people? Like, where do we, you know what I mean? And then it's just like the rent goes up, and it's just that's when the discrimination happens.
There's
like
mold
it's just
and lead, and there's all your house is falling apart, and then and even then,
Jamaica on one over here.
I am okay. I'm hot.
It's just
a lot.
And when you think about policy, I mean, I hate to go back to policy, but
that's
it's
what it's
across
all
the
about.
board, like system economics, like it's about community development, like
It
it's
is.
all of those things connected,
So
education.
that's all in. So housing, education, health, economic mobility, and justice,
All
because
of
they
that.
all intersect.
All
And you have to
intersect.
look at, when you mess with one, you impact another.
Absolutely.
And so you have to look at them comprehensively together.
And 9 times out of 10, if a person is homeless or actively couch surfing, they're more than likely 10 times likely to be in these other systems.
Right.
And vice
exactly.
versa. So that's
right.
also a problem. So,
Right.
ooh, y'all, it's getting hot up in
All
here.
right, we're gonna take a quick break, get ourselves together, and we'll be back in a minute. Thanks so much.
The persistent disparities in our region are driven by underlying inequities such as poverty, racism, and discrimination. That's why Interact for Health is committed to advancing health justice. Health justice takes equity a step further by changing systems in order to achieve sustainable and equitable change for the long term. Interact for Health's mission is to ensure people in our region have an opportunity to live their healthiest lives. The organization works in a 20-county area surrounding Cincinnati and prioritizes Black, rural, and Hispanic communities, as well as children and families with low incomes. The dedicated staff focuses on tackling root causes by preventing unfair systems, policies, and all forms of racism and discrimination, amplifying community power through funding opportunities, and speaking openly, partnering with trust, striving for impact to achieve positive, lasting change at scale, and being relentless problem solvers. Contact Interact for Health today at 513-458-6600.
All right, we're back with the All In Cincinnati radio show here with Jamaica, Marche, and Shanetta. So, is there any last minute words of wisdom you want to offer? That no, you got some. It's okay. We calm down, Jamaica. It's good. I'm gonna start with Shanetta over here. And then please it's so much. We gonna work. That's why we all in this room, because we all have a part to play and we all gonna make some change as it relates to policy and systems. I'm telling you, we are. This is not by accident. This is because we're all supposed to be here. All right, Shanetta, really quick. Any last minute words of wisdom, and how can people contact you?
If you are Black and pregnant, please reach out to OEI here in Hamilton County. There is a QR code, but there's also the phone number 513-946-OEI. No, is that right? 946-4-OEI. I had to think about it like something's missing. 946-4-OEI. So if you're Black and pregnant, please reach out to us. And more than likely, you will get Jamaica, and she will help you to help navigate through these resources and help connect you to resources that's going to de-stress your pregnancy. Last words from me is care for yourself, love yourself. Love yourself, and that's getting the help if you need it, and getting support when you need it, and
getting it how you need it.
Thank you. All right.
All right, Marche, you're up.
All right, so folks, how you can get connected with Queens Village. So if you're a Black woman, no matter what, if you're a Black woman with that is childbearing age, you can connect with us on our website, blackwomenforthewin.com. You can text our number to receive monthly updates about the things that we're doing at Queens Village at 513-216-9277. Our Facebook is Queens Village Cincinnati. IG is Queens Village Cincinnati. Please follow us. If you would like to partner with us in any capacity, if you're a Black vendor in any capacity, you can email us at reachaqueen@gmail.com. And also, when you go to our website, please sign up for our newsletter. If you sign up for our newsletter, you will have access to all of our events. You'll be the first to know, and you'll be the first to sign up. And my last words, that was a mouthful, because we out here. Right. I would say my last words is just like, number one is it's okay to not be okay, to recognize that. Also to seek help when you need to. Therapy is a beautiful thing. I also would say create your village, whatever that looks like for you. It doesn't have to be...
Find your people.
You got to find your people,
Mm-hmm.
and that can look different. You know what I mean? It doesn't have to be, it's whatever you want that to be. So, find your people.
I love it. All right. Jamaica, you ready? I think you said Marche just stole yours.
She did.
Okay, let's start out with the contact information.
Let's start out. So I am Jamaica, like the country. I am on social medias as Jamaica Like the Country or Jamaica Gilliam. I am also the navigator at Hamilton County Public Health with OEI. And I am the executive director at Black Birth Circle. So if you are, I know. So if you are a Black birth worker, so that is not only doulas, but midwives, lactation consultants, so on and so forth, and you would like to find your village with us, then you can definitely find us at Black Birth Circle, and that's Black with a Q because we are all qualified. And I guess my nugget to leave you on is what we said earlier. Actually, it's okay to do things scared, and we do hard things all the time. Yeah. And so that's how we know that we can do hard things. But it's easier to do those hard things together.
I love it. Yeah. This has been a phenomenal show today. I have had such a fun time talking to you. Even though it was a heavy conversation, I feel like we talked about a lot of good things, provided a lot of resources, really honed in on policy and systems work. And I typically don't do this, but I always ask my guests the words of wisdom. But for me, today it was really about grace and trust. So I talk about this a lot. But give people grace. You just don't know what people are going through on a day-to-day. And then on the flip side of that, give people mercy, because things do go wrong, but you got to find a way to forgive people. And so I just want to leave with those two things today. And again,
do that for yourself. Give yourself grace.
And give yourself,
yourself
mercy.
some
Yeah.
mercy.
There you go.
Deserve.
Yay.
I love that. Yeah.
All right. Love this conversation today. It's been phenomenal. Tune in next time for All in Cincinnati.
We're rolling together now.